Look at this photo. This is Gerald Sepkoniyesh. He sent me this from the top of a hill in Colorado, smiling with his granddaughters. But what you don't see in this image, it is that 4 years ago, 3 different surgeons said he needed to have his chest open to survive. Gerald refused, and today he is more alive than many men of 50. Why am I telling you this now? Because Gerald discovered the secret that took me 30 years in the NHS to understand. Surgery is not a sentence of fate, it's a choice. And for many of you watching now, this choice could be the most dangerous mistake of your life. I am Dr. Andrew Collins, and in the next 25 minutes, I will show you the 5 surgeries you should never accept without first hearing what I have to say. Let's talk about real numbers, not theories. According to the British Heart Foundation, more than 14 million people in the UK are living with high blood pressure today. But here is the fact that keeps me awake at night. Between 4 and 5 million of our neighbors have hypertension and don't even suspect it. They are living their lives tending to their gardens while the cardiovascular system suffers in silence. Imagine a scene. A gentleman, after a morning walk in Hyde Park, sits down for his tea, completely unaware of the ticking bomb in his chest. High blood pressure is responsible for about half of all heart attacks and strokes in the country. According to NICE, the damage begins long before you feel ill. It is a slow corrosion, like rust on an old iron bridge, invisible but relentless. The damage happens in silence, without pain, without warning, and when you finally feel the tightness in your chest, often the system pushes you towards the scalpel as if it were the only way out. But it isn't, and it is exactly this truth that we need to uncover. We need to understand that prevention and information are our greatest defenses against a system that sometimes prioritizes late intervention. Every year, the NHS spends billions on treatments for heart diseases that could be avoided with early diagnosis and lifestyle changes. Opening the chest of a patient over 60 years old for heart surgery is a massive trauma. Without the NHS, conventional heart surgery, sternotomy, is still the standard for many. But for a body that has already fought for decades, the risks of pulmonary, renal, and infectious complications are immense. Almost no one explains to you that the length of stay in ICU for the elderly can double. And the post-operative mortality rate in patients over 75 years old can be up to 3 times higher. Think about the impact of a prolonged recovery away from family. It's a high price to pay. The British Geriatric Society recommends a comprehensive geriatric assessment for all elderly individuals before major surgeries, something that is not always strictly followed. Today, we have TAVI, transcatheter aortic valve replacement, and percutaneous coronary interventions, PCI, to unblock arteries. They are procedures that enter through a small artery. Less trauma, recovery in days, not weeks. A patient can be back home having their tea and reading the newspaper in record time. The BHF has been a strong advocate for these approaches, showing that they offer comparable results with much less risk to the elderly patient. If your specialist hasn't discussed this, they are treating you with 1990s medicine. You deserve the most modern and least aggressive. Ask, what are the options that do not involve opening my chest? Your life may depend on this. Insist on exploring all possibilities. This is the surgery I see causing the most regret and prolonged suffering. A fundamental study in the journal Spine revealed that patients over 65 years old face complications exceeding 40%. We are talking about infections that do not heal, material failure, and something even more insidious, the adjacent segment disease. Imagine the frustration of a hard-earned recovery only to find that the problem has shifted. When we fuse 2 vertebrae, the adjacent ones need to absorb all the impact and fail. In 2 years, many patients are back on the operating table, facing a new problem. The most shocking: studies show that for many, intensive physiotherapy and weight control provide the same pain relief with 0 risk of hospital infection. The best surgery is the one you decide not to have. Think about it. Would you exchange a 40% risk of complication for a treatment that offers the same result without risk? It's a question your doctor should ask. Don't be swayed by quick promises. When the diagnosis is cancer, fear takes control. The instinct is, take this away from me now. But the goal is not just to remove the tumor. It is to give the patient more good years of life. And sometimes aggressive surgery does exactly the opposite. In the United Kingdom, we see cases of rescue failure in almost 20% of elderly patients undergoing major oncological surgeries. The tumor is gone, but the patient never returns to being who they were, with drastically reduced quality of life. Imagine a grandfather who can no longer play with his grandchildren or has lost the joy of tending to the garden. The emotional and physical impact is devastating. Procedures like the Whipple are surgical marathons lasting 6 to 10 hours. For an 80-year-old heart, this is like running an Olympic marathon without training. Sometimes modern radiotherapy or targeted therapies offer years of life with dignity. Ask, what is the plan for my quality of life? Are there less invasive options that allow me to continue enjoying? This question opens doors. Don't rush into irreversible decisions. The NHS has invested in multidisciplinary teams to discuss all options, but you need to be proactive and ask the right questions. Hip and knee prostheses are miracles of modern medicine. They restore mobility, but they are elective surgeries, which means you have time to prepare. In the United Kingdom, the risk of embolism and thrombosis after these surgeries in patients aged 75 and over is constant, especially with comorbidities, but rehabilitation can reduce your risks by half. The NHS is increasingly adopting rehabilitation programs, recognizing their value. If your surgeon wants to schedule the date without first putting you on a physical and nutritional preparation program, they are putting you at unnecessary risk. If your surgeon has not put you on a preparation program, they are putting you at unnecessary risk. Do not operate on an unprepared body. It's like preparing a car for a long journey. Your body deserves the same. This is the only surgery that you do not choose. It chooses you. In patients over 75 years old, the mortality rate in emergency abdominal surgeries reaches a shocking 30% to 50% in the United Kingdom. Why? Because the body was already at its limit. An elderly body under sudden trauma struggles on many fronts at the same time. Imagine a loved one being rushed away with no time for thoughtful decisions. Detecting problems early is the difference between a minor laparoscopy and a fight for life. Persistent abdominal pain or changes in habits in those aged 60 and over should never be ignored. Have this conversation today. Knowing what you want before the crisis happens is the greatest gift for your loved ones. Don't wait for the ambulance siren. Prevention and communication are your greatest allies. Do you remember Gerald? He asked the right questions, no? What happens if I do not trade now? 2. Is there a robotic or minimally invasive alternative? The NHS has invested in this, insist. 3. How will my real recovery be, considering my conditions? Request the scenario for you. So, what is your personal complication rate for this procedure in patients aged 70 and over? Transparency is essential. If you don't ask, you don't decide. Gerald decided to leave. Your health, your life, your choice. Do not give up control. Assume it. Be the captain of your own ship. Information is your power. I am Dr. Andrew Collins. I spent 30 years in the NHS operating on hearts, but today my greatest success is helping you keep yours intact. If this video changed your way of seeing medicine, comment, I will ask first. Share this video with everyone over 50. You may be saving the quality of a whole lifetime. Sign up for more truths. Your heart has a long story. Let's make sure the ending is extraordinary. Until next time.